My last and second guest is someone trying to innovate from the outside in a big way. Kent Dix. Kent is the CEO and co-founder of Life365, award-winning serial entrepreneur, thought leader, innovator, leading pioneer in M-Health field, which is medical apps, lower-cost cloud-connected health solutions. His whole mission and focus is broadening accessibility through remote healthcare solutions, scalable results across many, many lines, trying to bring together all kinds of disparate, interesting businesses together under one mission and one mission only, and that is to provide better healthcare where the customer is truly in charge. Ladies and gentlemen, please welcome Kent.
Thanks, Bob.
When we were setting this up, movies I know. Healthcare is like this big giant monolith, and I said, Kent, we're going to start off, just walk me through this.
So who knows healthcare? I mean, there's not a lot of people that actually know
Right.
how it's going to be, in the present and actually in the future, right? I mean, we've talked a little bit about that. It's changing as well. I don't think we have the slides up quite yet,
There you go.
but this becomes, I've been probably doing healthcare for the last 13 to 15 years in what we call digital health. It's actually trying to connect people, outside the hospital, in their home. It's amazing to me after 15 years that people, I've been close to it, that people don't know this is occurring, that you can actually connect at home to your doctor remotely, wireless scales, blood pressure, glucose, have a doctor or AI actually monitor you from a distance so you don't have to be in the hospital. You're starting to see trends that are occurring where, clinics are now starting going into Safeway, they're going into Walmart, let's go back to the previous slide real quick, that's okay. This is a trend that I actually kind of want to show really quickly, is that the consumers are really now starting to get to the point where they're going to now demand how they interact in healthcare. They've done it in, I actually go through how we consume goods and services through Amazon. We did it through Uber. You did it through Airbnb. You're going to do it through healthcare as well. In the future, it's not going to be that a healthcare professional tells you and a payer tells you exactly how you're going to consume healthcare. You as a consumer are going to say, no, I actually want to do it through behind a laptop. I want to be able to have, blood draw or labs come to me, or I want them to be disposable labs to do that. You're going to tell the marketplace how you want to consume with healthcare, and that's what we're trying to help with.
When I first met with Ken, he talked about a derivative, so to speak, of this slide, and I thought, okay, now I'm understanding. Now I'm totally getting where you're trying to go here.
I mean, think about the changes we've done with this. I mean, we have disrupted an industry, that's out there. You've disrupted the taxi industry with Uber. I mean, now we just commonly always think about using potentially Lyft and Uber, right, that's out there. That's how we demand to do that. We do things differently now because we have Uber and Lyft available to us. I mean, here in Arizona, taxis where you didn't kind of use them, out in the far reach of North Scottsdale and everything else, but now Uber allows you to be anywhere, right, and Lyft does as well. And Airbnb does that for you as well. I mean, to go through and you've changed and disrupted the whole hospitality industry to actually put it at your fingertips to stay and do what you want to do as well. It's going to be the exact same thing in healthcare, except for I have a real sensitivity around, doctors and health systems that are out there and patients as well to actually kind of understand, from all angles of how that disruption occurs. I mean, patients want to consume healthcare on their terms. 90%, can't afford or don't want to be in the hospital system or the hospital. 90% don't and it can't afford assisted living or independent living. But on the same token, when you have doctors and you're now remotely monitoring patients and you're putting technology and solutions in place, they're like, does this mean I have to monitor more patients or be responsible for more patients? Am I going to get paid for it? If data comes in and I don't look at it, am I going to get sued, from that perspective? But if you think of all the other industries that are out there, a lot of those stakeholders either had to change as consumers want to change, or they went to the wayside to do that. I'm not saying doctors are going to go to the wayside, from that perspective, but we have to change around reimbursement, around how consumers want to embrace healthcare, and that's the big challenge.
One of the main thing that you've consistently said since the first time I met you was the customer. It's the customer back in. I think this next slide drives to that point.
Yeah, so, if you've been around healthcare dynamics over the last probably 10 years, 10 or 15 years that are out there, a lot of people have created solutions to connect patients or to do a diabetic solution or a kidney care solution or a hypertensive solution for home. But they were very disparate. They were unbundled. They didn't actually deliver services with them. And it was very, very hard for health systems and others to be able to implement them, especially if doctors were being paid, for every time they saw, a patient coming into their office and then wanting to connect to them outside the office and they weren't getting paid. There was really no incentive to do that. But today, I think the problem that we solve or are helping to solve is putting the patient at the center and then realizing that a patient is also a consumer. A patient has very, specific ways that they engage. I always say, I'm really motivated by my parents of that age, where they actually are living in Ottumwa, Iowa, right? There's an Iowa connection. And we're 1,500 miles away, and the family is, and they're in independent living, but we're constantly trying to connect to them and make sure that they're okay and make sure they stay out of the hospital and that they're safe is the number one thing. And the one thing I learned from my mom about this is that she'll engage the way she wants to engage. If a doctor tells her to do something or if her son tells her to do something, she's going to do it the way she wants to do that. So we want to build services and solutions around a patient that engages them the way they want to engage, right from that. If they need remote connectivity to a doctor to send their biometrics in, great. If they need, behavioral health services or they need transportation, to be able to get to their doctor back and forth, we want to be able to put services and solutions and partners around us that solve the whole issue to personalized care for my mom, not make it so it's just, a solution that there's only one solution out there. I want to be able to have multiple different ways that she can engage in her own health care. And I always say, lose the battle, win the war, right from that. So we've got to think differently. We've got to put solutions together that are economical and engage patients in their own care.
I jumped the shark recently. We were having dinner with some friends, came over, and my daughter came over, and she's 29. And she got up at one point, she said, "You guys have officially jumped the shark." I said, "What do you mean?" She goes, "You realize you just spent the last 20 minutes all talking about your ailments."
Yeah.
And my mom used to always say, when you have your health, you have everything. And I thought to myself, it was last week, and I was thinking about this presentation. I thought, boy, it doesn't come into play until it needs to come into play. And then once it comes into play, you hope to God that you have solutions ahead of you that are easy for you to get the relief you need or the answers you need. Right. And that's what you're trying to provide.
Actually, we're trying to be a little bit disruptive and actually, we want to accelerate some of the changes in the marketplace fairly fast because the market started to accelerate fast too. But we also want to do it in a non-traditional way. The first speaker talking about, here's the obvious answer. I actually want to go to something that's the non-obvious answer. I always talk about it, nothing against my mom, but if I put a package in front of her and it had a tablet inside to connect, she would take the tablet out, set it to the side, and play with the package, right, and the gift wrap, right, from that standpoint. So I'm saying if that engages her some way in her care, if we can nudge, if we can, put connected solutions on a smart TV and then give her Netflix for free, right, because she was actually engaged in her care and took her medication, and that's a $10 expense per month, but it saves a $10,000 hospital admission. Why wouldn't I do that?
Interesting. Yeah, I think you had one more slide you wanted to talk about.
Yeah, so this is, kind of looking, I'm a big believer that one solution doesn't fit all. And part of the things that we're looking at is how consumers want to consume healthcare on their terms. One point I'll make really quickly is that, over and over again, we have, large self-insured employers that will come and say, we'll use your solution, but we'll give it to our employees and we'll dog food it with them, and see if they use it. A lot of times people are so busy at work and they're not necessarily the ones that are becoming compliant in their own health. There might be, you give them a Fitbit, but they're the people that are healthy already and in sports and performance and not going into the emergency room. And the people that really do need it, the people that are actually on this curve, where they're starting to become hypertensive or diabetic, and we're trying to hold them before they go to a high-risk patient, they're not necessarily engaged in their own care. But if you take that solution and offer it to them as an employee benefit and allow them to use it with family members like me, to be able to go through and use that with my aging parents, and that can take the worry off my mind, that's a big plus to me, right, to do that. So we've got to keep thinking creatively. Like you want to make your employees healthier, but also it's not just physiological that's the problem. It's also behavioral. It's also about what's taking up their mind space. And part of their mind space and concentration could be worrying about their parents or children on either end of the spectrum that are causing them issues.
And the environments they're in.
Absolutely.
They're at home environments or...
So part of the things that we've done, looking at consumer behavior too, is people want to have things, they want what they want when they want it. They want things delivered to the home. We have actually some solutions that are in boxes that are these e-connected boxes that allow us to be able to take vital signs and biometrics. But I don't think probably a majority of audience knows is that Medicaid and Medicare, well, the Medicare Advantage plans are actually starting to reimburse for food, for social determinants of health. They're starting to reimburse for transportation because they realize it's kind of Maslow's law a little bit, that if you don't go through and take care of your basic needs, that you're not going to take care of your health needs either, right, as well. So we want to be able to go through and help with the distribution, whether it is connected devices to get the biometrics, whether it's food with some of our partners, whether it's testing solutions, and we have a great relationship that's starting to develop with a large testing facility here in Arizona that actually will start putting their vital signs, not vital signs, but their lab test on our app, our patient-centered app. One of the things they're doing also is they're now starting to send phlebotomists to the home to take blood draws. And the interesting thing I'm trying to solve, when I go to my doctor, they give me this piece of paper, and it typically is in the back of my car for a month because I don't have time to go to the lab to be able to get it. But now I can just go online, schedule the appointment, and the phlebotomist comes and does a blood draw for me the next day, even at my office do that. So we want to be able to do a variety of solutions in kits. And then we have smartphones and tablets that interface to 300 different medical devices. The TV is the interesting one. Especially we got a break here in the industry with seniors, right, in healthcare, is that when we walk into a home, this is 10 years ago when I had my previous company before we sold it to a Lear Abbott, it's that we didn't know if we had connectivity or not to be able to get data from a wireless scale or blood pressure up. But with now over 300 million OTT set-top boxes,
Smart TVs.
right, and smart TVs, that a lot of times they're cutting the cord, they're going and getting Wi-Fi or cable, the seniors are, and that gives me now the opportunity to have connectivity in the home, so I now can connect to the seniors. So we're going after the OTT set-top market as well, big time.
Interesting.
Right, to be able to run our application on it. And then the last one is wearable device that we are actually working. We are actually a partner with Mayo Clinic here in town, and ASU. We're the only Arizona company chosen to work with Mayo Clinic and ASU, and we think that's going to be great. But a wearable device for rapid diagnostics. So now you can start taking testing that you normally would do at your doctor's office, whether it's for A1C or glucose or creatinine levels or BNP levels or other levels. All that's starting to move now to the pharmacist's shelf. Pharmacists now are getting the ability to prescribe medication and take care of patients more. And then those rapid diagnostics are now moving to the home. And the wearable device we have and the patents that we put around it allow us to be able to take that blood test at home, touch it to the band, throw the disposable away, have the data go to the cloud, and just make sure that the patient's doing okay, maybe run it through analytics or AI, so that we can look at a broader population of patients really economically and do it on your terms instead of you having to go to your doctor instead.
You alluded to the fact you had other companies and you've sold them, and so you're used to doing startups.
Yeah.
When you look at what you're trying to do here and what you're doing with LIFE365, now that you're in it, give us a sense of some of the challenges and barriers that you're trying to get around or go right through.
Well, it's healthcare. Drop the mic, right? I mean, healthcare is.
Where do you start?
Yeah, I mean, healthcare has its own. Has its own timing, right? It has its own. way of kind of doing business. We are constantly pulling, right now, are being pulled between the C-suite and healthcare organizations and the doctors and the clinicians and then the patients as well. What they want when they want it, and the C-suite needs to have better economics because of value-based care and changing in reimbursement, to the docs that are going, can't I just take 2 hours off to go spend time at my son or daughter's soccer team, right, to do that? So are you going to start pushing more people to me instead? So we're constantly fighting that challenge. But the one thing that I do know in all this as well, because I did another healthcare company before this, and we sold it, is that now before we didn't have reimbursement. Today, 30 reimbursement codes are now opening up, January 1st, 30 reimbursement codes are opening up to allow doctors to actually get paid for remotely monitoring a patient, whether they're in front of them in their office or whether they are at home, and they have parity in reimbursement to do that. So a lot of those things are opening up, but also now you're seeing non-conventional things happening. CVS just acquired Aetna. Best Buy acquired, Jitterbug or Great Call. It's going to be Best Buy Health. They're actually going to be acquiring a payer. Walmart has, partnered with Quest Diagnostics and putting centers in and clinics in. From that, they are going to acquire a payer. It could be Humana, it could be other people. Apple Health will have their own health company, right, as well. Safeway has clinics in it. I think Sonora's in 50 different Safeways, from that perspective, and have the clinics. So all of it is the dynamics are changing more to be closer to the consumer for healthcare.
And I think one of my questions you just answered, which is, how are you trying to capture around these businesses that are evolving and changing with the same kind of a mission, which is convenience, helping to make it easier to provide healthcare? You're trying to do that. You're trying to take advantage of other businesses too that are changing and adapt with them, as opposed to seeing them as competitors.
Yeah, I actually think that we are an enabler for a lot of these business models to change. Like whether we're dealing with a large distribution company, let's just take like a McKesson that has razor thin margins on pharmaceuticals. If you have, Amazon that's putting over $500 billion into healthcare, $500 billion into healthcare, they can really mess with those margins big time. So, how do you bring new revenue streams into McKesson? AMR Ambulance, which is the largest, ambulance company in the world, which is a partner of ours in this ecosystem of integrated health, they're constantly, picking up a patient and taking them to the emergency room and into the patient gets admitted to the hospital. The payers and the insurance companies are saying, I don't like you because you're costing me cost out there. A lot of times now, if AMR picks up somebody and takes them to the hospital and they're not admitted, then they don't get paid. And so their model now has gone to 30 to 40% of the revenue is billed but never paid because they're not getting paid for it for a certain reason. So now, they're required to pick up people because of law. There's one person that's in Washington, D.C. She calls 911 every single day because she's hungry, and they have to pick her up and take her by law. But now they interface to Lyft, and they've done over 200,000 Lyft rides per year now to be able to send a Lyft ride out to her to pick her up and take her to social services instead of the emergency room. So we're helping our partners be able to turn around their business model and their revenue stream, maybe scream was the right word, to be able to go through and make, to start generating new revenue based on the new consumer model. One other thing really quickly, we're also going through and trying to make it so when we look at a person, a member, a patient, however you want to identify them, whether you're on the payer or the provider side, is we want to look at that person and say, we want to consider a relationship with you. We want to go through, and see how we can service your need. I don't want to just go through and say, you're a diabetic patient, I need to send you out strips, and that's all I view you as. I also view you as, you may have hypertension, you may have food needs, you may have housing needs, you may have a lot of different needs that are out there holistically that affect your well-being and your health. And that's how we have to look at it under a value-based scenario.
Let's ask, who has questions? Yes, right here.
With the advances in science and technology and creating these hubs, how do you see this affecting long-term the cost and being able to be covered for things like life insurance and insurance in the long term? Because as we find out, this is a sign that you might be cancerous or whatever it might be,
Yeah, actually, I take that question more into the genomics side, right, of the business, which we're not really, in the genomics side of the business. But it is a good question because I've questioned, just the genomics side of it. Like a lot of us went out in 2013 and 14 and did 23andMe. I know I did, and my wife did. And then all of a sudden, we start seeing on the report. I won't give all this away, but we see like APOE4. What's APOE4? Well, it means that potentially she has, or I have, the ability to have Alzheimer's in the future. Do that. Did I just violate my long-term care insurance policy, right? Because I know that that showed up on 23andMe when I didn't know what the hell APOE4 was. So I think there's a lot of ethics that are going into this that people don't even know what they're signing up for. They don't know what they're testing for. And I think it comes through a lot of responsibility and education, right, from that as well.
One more question, anybody? Yes.
This is fascinating. What about the lag and some regulations FDA clear waived and the possibility of accelerating a lot of the things you are showing up there into the home? How do you see that falling out?
The FDA has actually been, I think in my eyes, been pretty good over the last 6 to 8 years 10 years that we've been involved. In my specific area, when we looked at, connected devices going through smartphones and, IoT devices and everything else with it, when I did my first solution, which is called HealthPal, which is an IoT device, and I submitted my first FDA clearance, they thought I was killing the patient. They just did. Because they never envisioned that you'd be connecting to somebody outside the four walls of a hospital. And who's going to run in and turn off the alarm, and who's going to run in and do whatever with that as well. Since then, they've come up with new directives like the MDDS, which allows us to be, I know this is getting over the top a little bit, but it allows us to be able to not see that smartphone, right, as a medical device, but it's a conduit, right, talking to other medically cleared devices. It could be wireless scales or wireless glucose or others. So it does make it easier for us to be able to scale and get out faster without having to have an FDA clearance from that standpoint, being a conduit. But I think the FDA is realizing that. And I think under, whether you agree or not agree, but under the current administration, they're actually trying to lift a lot of restrictions that have been put out there as well to try to push more things out. One of the things I'm very, very, very passionate about, and I've testified in front of Congress about it before, is veterans in rural locations. I just am, and we've had a lot of restrictions on how we can help vets from a medical perspective. I mean, if you're a veteran that lives in a rural location and you're 3 or 4 hours away from your doctor, chances are you're probably not going to get care right away. You're going to exacerbate your disease, and it's going to be a much worse experience for you. So if we can go through and connect you remotely, especially in rural regions, that's why I like working around with the Walmarts of the world and others, that they're in rural locations, they have distribution, they're starting to put clinics in. If we can be the last mile to connect into that rural location and be able to give access to care that's in Phoenix or other locations, then that's a great thing. Just one other point too, is that here in Phoenix has been very, very innovative. Mayor Mitchell out of Tempe has been incredibly innovative, where he's actually been part of working with the VA to shorten the VA waiting lines by sending the Tempe Fire Department randomly to veterans' homes to take vital signs to make sure they're okay. And then if they aren't okay, obviously they're going to transport them, but actually get that data back to the VA to make sure that they're okay and try to monitor their treatment remotely.
Kent, thank you.
Thank you.
You're doing great work. Congratulations on yet another successful company.
Thanks, Bob. Thanks for having me.
You're welcome.